Arthritis is an issue that we see in clinic every day. Most commonly, I'd say we see arthritis in the big toe joint. It's medically referred to as hallux limitus. There are lots of non-surgical ways that we address this. Typically, we have patients get into stiff-soled shoes, which acts as a splint to the joint. We'll recommend inserts or custom orthotics, and it's the typical home therapies that work very well: rest, ice, and anti-inflammatories. If patients do well with that, that's really all we need to do. If they're not improving with those home therapies, we'll recommend things like steroid injections into the joint, and sometimes patients need to go to the operating room to have this addressed. Surgically, we do things like cleaning up the joint to improve range of motion, and if it's severe enough, we'll typically fuse the two bones together in a good position to eliminate that pain.